My name is Safwan Jaradeh, and I am a full-time neurologist here.
I could do it in 2 to 3 months.
My subspecialty is predominantly autonomic disorders. I grew up actually in the Middle East. I'm originally from Syria, and I was on the science track when I was in high school and college. And I really never thought for a minute that I was going to do medicine. So my favorite uncle, with whom I was very close, developed a severe gastrointestinal illness and had a bleeding ulcer and almost died. And then he was in the hospital. And then shortly afterwards, my dad had his first heart attack. And he was in the hospital. And because I was the oldest son in the family, you know, in our tradition, you have to basically go and check on your uncle and check on your father. Both recovered, but I became, number one, fascinated by the health system. And number two, I began to realize the incredible variability between doctors. Some were terrific and some were not so good. And that's when I became serious about medical school. And I thought, you know what, if I'm going to go to medical school, I want to make sure I'm one of the better half. So I went to medical school, and with the idea really that I'm probably going to become either a cardiologist or a gastroenterologist, simply because that was my exposure. And then as I started studying in medical school, I became fascinated by the nervous system. And I thought, you know, the brain is an incredibly complex organ, and the peripheral nerve. And then I realized, you know what, they control everything. And then I decided I'm really going to become a neurologist, to the frustration of my father and uncle, who kept reminding me very politely when I was in my last year of med school that, remember, you went to med school to become either a cardiologist or a gastroenterologist. And I told them maybe I should be a neurologist and remain politically correct with both of you, because I wasn't going to start a family feud. In a way, I feel this has been a rewarding journey, because I fulfill my dream of being a neurologist, but at the same time, I see so many patients with gastroenterology and so many patients with cardiac disease, and I feel I paid homage to my father and my uncle, and I really think it came a full circle, so I'm very happy with my field.